I would say at the time we developed this theory, probably the only theory that you could call a nursing theory of epistemology or nursing epistemology was Carper's patterns of knowing, which posit that to know anything for nursing purposes, one has to engage in all four pathways: personal knowing, empirical knowing, ethical knowing, and aesthetic knowing. So take that back to crafting unique responses. In the practice of nursing, we draw upon the research base of nursing. We don't apply research findings as though I use the silly analogy of applying paste with a tongue applicator. We don't stick it on there. Mm-hmm. I like to use the word employee. We employ knowledge of our science that comes from our research. We also employ knowledge of the values and then the ethical considerations that are a part of how we understand nursing. We employ our own intuitions, our own experiences, and we actually craft and extend our nursing responses as an expression of aesthetic knowing. We put all this stuff together, craft it uniquely for the situation. So we don't use canned responses. Not to say we can't have protocols. We can have protocols as long as we understand that those are broad guidelines that may or may not have any relevance in a given situation. Just because a situation from the outside looks to contain certain important factors doesn't mean that those factors will be anywhere in view once the nurse enters into the world of the other and comes to know the other as caring person. And here I've remembered one of the concepts that we added as a concept after we worked with the theory for a number of years and others worked with the theory. And that's the concept of direct invitation. So when a nurse enters into the nursing relationship with the person and seeks to know that other as caring person and seeks to celebrate and affirm that other as caring person, the nurse, one of the ways the nurse does that is by extending a direct invitation. And it doesn't have to be a canned way of extending it, but I'll just give an example. I'm Savina Schoenhofer, and I'll be your nurse today. And well, I've read your care plan and understand what the medical situation is and all that, and I'm prepared to work with you on those issues. The one thing I really need to know from a nursing standpoint today is, how can I best care for you today in ways that matter to you today? We have to let the patients know that what nursing is about is caring. Mm-hmm. Nursing is not about helping physicians with their work or helping PTs or lab technicians with their work. I mean, we all work together, so we all help each other. But that's not why we have a nurse in the picture. We have a nurse in the picture to recognize the other person as caring and to, through that recognition and acknowledgement and celebration and affirmation, participate with them in growing and caring, living the meaning of our human lives. So I know a lot of people in nursing are scared of the word caring. When I first studied nursing back in the early 70s, we were very much into putting nursing on the status of science. And so most of the people that I studied nursing with early on would be saying, caring, that we left that behind. That's the old soft thing that doesn't have any science, that keeps us as slaves in the health care institutions, et cetera, et cetera. However, back in the old days when we lived caring, we never studied caring. Mm-hmm. And today we have this huge body of nursing knowledge of caring. And the more nurses can tap into that body of knowledge about caring and nursing, the more they can bring the true gift of nursing to those persons for whom they offer to care. And extending a direct invitation is a great way to affirm that in yourself as a nurse, to let the person you're caring for and with know that, hey, this is what I'm here for. Mm-hmm. I'm here for you. I'm here to care for you in ways that are meaningful to you. And it might be changing your dressings with the minimum amount of pain and the least effort on your part. And that's exactly then what I will do. But it might be, and I like to give this example because it's so dramatic and so cool. In a project we were doing at a hospital in South Florida, a nurse went in and extended a direct invitation. And what came out was the patient had had a stroke, was moving towards being dismissed to a rehab center and then hopefully home. But the thing that mattered most to her that day and that moment was, will I ever be able to enjoy playing the piano and enjoy entertaining my family and friends on the piano? And of course the nurse knew the situation, knew the infirmities and everything and the abilities around the stroke situation. And the nurse also knew that there was a piano in the hospital. And what that nurse did, and this gives me chills to even talk about it, was get help and go get that piano and bring it to that patient's room and help that patient pull up to the piano and play. That's what mattered to that person that day. Mm-hmm. That's not all the nurse did, but that was the nurse's immediate focus because that was the person's immediate focus. The nurse didn't let the person lay there with drool on her face or forget to give the medications or not give the medications right or forget to get the person to PT on time, nor forget to reinforce what was done in PT. No, the nurse did all that too. But it was a part of the nurse's expression of caring. It wasn't done because that was an order, quote unquote, or a plan of care for some other discipline. All those things are done because the nurse sees those things as ways of communicating caring. And it's through the communication, effective communication of caring, that we enable others to grow in caring. That's what nursing's about. That's what the theory says.
Wonderful example.
I want to just add a little bit to that, if I can.
Yes, you can.
Because we're at a good point to add it. And that is, more and more work is being done with the theory of nursing as caring. I personally do very little developmental work at this point. I consult with others and dialogue with others who are working with the theory, but I don't actively contribute to new development of the theory. One of the people who has done the most work and the most visible work with the theory of nursing as caring is Dr. Rosanna Loxon. He's a professor of nursing at Florida Atlantic University. And using nursing as caring as his grand theory, his nursing philosophical framework, he has developed the middle range theory that's called technological competence as an expression of caring and nursing. And this has helped nurses tremendously figure out, well, you know, should I do what's on the Cardex, or should I do what the patient's calling for? You don't have to choose. Mm-hmm. You do it both. You do it all. But it's not done because it's written on some piece of paper there. It's written when you enter the room and approach the bedside of someone who has all kinds of tubes and IVs and stuff. You don't ignore those tubes and IVs, but you go to the person, and then through and with the person, you manage these accessories, and you manage them competently because you are giving those as your expressions of caring.
Okay, some of the students who are going to be watching this video will probably say, it sounds wonderful, but we're in the real world and we have these constraints of we have too many patients to take care of and not enough time. How do you incorporate caring into your practice?
It's a matter of having your whole practice be an expression of caring. And that involves intentionality. I mean, that's one way to talk about what it involves. Forming the intention, preparing yourself, first of all, with the knowledge of caring. Unless your nursing education program provided opportunities for you to study in depth caring and nursing, you probably don't have much of a body of knowledge about it, unless you've gone on your own. So one thing to do would be start studying the literature on caring. One of the things you'll find in the literature is an article that Ann and I published in RN a number of years ago. The title is something like, "Is There Really Time to Care?" And of course that's everybody's immediate, yes, but, yes, but, yes, but, there's no time. There's no time not to care if you claim to be offering nursing. And one of the things that is so useful about Dr. Loxton's theory is that it tells us our expressions of caring don't have to be these big dramatic things like bringing a piano in. When we care for the person by competently managing the technologies that are being used by and on behalf of the person, we are communicating our caring to them, and they are receiving that communication, and they are growing in caring. Excuse me a minute, I'm going to have to take a drink.
Which is why I asked you the question, because I knew that that is a question that many many of our students will wonder about, even though I knew the answer.
Yeah. Well, an aspect of that question, we don't have time. I think one aspect of that is, unless a nurse is what I call thinking nursing, based on an explicit theory of nursing, they don't have the language to even, if your functional theory of nursing is what I call nursing as medical assisting, then what you're paying attention to is the medical plan of care. And what do I need to do to get, to help this medicine person see that their goals and their practice is successful. When you have a theory of nursing that's really a theory of nursing, and I don't care whether it's the theory of nursing as caring, or whether it's Orham's self-care deficit nursing theory, or Roy's adaptation nursing, or Rogers' science of unitary human beings, whichever one of those theories, any one of them will give you a ground to stand on, so that you know what your nursing is, and you can continue to assist others as they should be assisting you with your work, but the nursing needs in a situation are getting met. The real nursing needs.
Well, and I think one of the things that I would like to point out is that it doesn't take a lot of time to be authentic and to express caring.
It doesn't take a lot of time. It takes, let's put it this way, the more one studies and learns about authenticity, and the more one studies and learns about caring, the more effectively one can communicate those values. But you're right, I mean, we're all human beings, therefore we're all caring. Therefore, we all have ways of expressing caring effectively with no study of caring. But here we are, the profession that I would say I've heard very few nurses say that caring is not a part of nursing. They don't all agree it's the center, it's the key concept, but I haven't really heard any say that it has no place in nursing. And but we haven't studied about it. We don't, that's not a part of the curriculum in every entry level and graduate level nursing program. So if caring is truly one of the core concepts, if not the core concept, shouldn't it be formally taught and formally studied in every program of nursing education? I think it should.
I'm not sure we do a great job of studying the other constructs of the meta paradigm either. So, but your point is well taken.
Well,
yeah.
I think the one explanation I would give for that is, the question I would ask is, does the curriculum express clearly the unique focus of nursing as a practice discipline? If it doesn't, then you're just teaching odds and ends, and you're leaving it to the student to figure out how to put these odds and ends together in a way that they call nursing. It's not a highly organized approach to effecting the, to bringing the gift of nursing to the public. And as a profession, that's our responsibility. That's our social responsibility. Who else is bringing nursing? Who else has the expertise? Each discipline has it's not to say that each discipline doesn't bring caring in the ways of that discipline and in basic everyday human caring ways. But nursing is the discipline that has as its core, or at least centered close to the core, the idea of bringing caring into the world of the patient and into the world of the situation. I think I'm not going to go on and on about this much longer, but I just can't express strongly enough the value of having an explicit theory of nursing, whatever it is, and crafting your study and your practice in the context of an explicit and well-developed theory of nursing. And I think with any of the theories of nursing, you'll find caring hanging around in there pretty close to the center.
Okay, just to shift focus just a little bit, not a whole lot, but tell us about the theory of caring, nursing as caring, how it is applied to a difficult, an interaction with a difficult patient, or an interaction with a patient who is non-responsive.
Okay. You must have read the book.
I did.
Oh, there's a chapter on these things. Again, I think it gets back to intentionality. When we approach a patient whose behavior may be scary or may be disturbing or whatever, we can approach that person from a nursing perspective, or we can approach that person from a medical perspective, or we can approach that person from a psychological perspective. If we approach the person from a psychological perspective, we're going to be using terminology like angry, what are some of the other words we used to use in psych nursing? Rebellious, non-compliant. Notice how your voice has to go up when you make all these accusations. What else? When you approach a person from a nursing perspective, you approach that person with the active intention of understanding how that person in this moment is living their caring. Now that's your task as a nurse, at least if you're practicing from the theory of nursing as caring. It's not your only task, but that's your core nursing task. And so here's where it's necessary to have a knowledge of caring, a developed knowledge of caring. With the intention and with the knowledge, you can approach the person from a completely different perspective. And maybe, let's say you understand, well, this person, how I understand this person living caring in this moment where they're screaming and yelling and banging on the walls and stuff, is they're living their, what they're feeling honestly. Mm-hmm. How can I honor honesty? How can I honor authenticity in a way that enhances personhood? And enhancing personhood and truly honoring authenticity, I think, and caring for the person in the whole moment would be helping that person channel those expressions constructively rather than destructively. But if I go in, you know, with my, what they used to call it, show of force, mm-hmm. and sometimes show of force is an expression of caring. When it's used,